Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic.
Let's talk about what everyone is talking about, the new coronavirus. Is this the big one? Honestly, it's hard to say, but it's moving fast and it doesn't look good. What started in the city of Wuhan in early December has now grown into a global health emergency. And as the contagion spread beyond China, so did the fear. A virus they started calling 2019 nCoV. The N's for novel, meaning new, and CoV stands for coronavirus. And this is what it looks like. It's like viruses we've seen before and comes from the same family as SARS and MERS. But we'll explain the science in a bit. What do we know about coronaviruses? Well, they're common and usually found in animals, but 6 of them were known to infect people. This new one takes that up to 7. 4 of those strains are pretty harmless and might cause things like a cold. The others are killers. Severe acute respiratory syndrome showed up in 2002 and killed 1 in 10 patients. Experts think SARS jumped the species barrier from the civet cat to humans through bats. In 2012, it was the Middle East respiratory syndrome, which kills roughly 1 in 3 people who get it. MERS is thought to have come from camels. Now, SARS disappeared in 2004, but a few cases of MERS did pop up recently. And now there's this new strain, which we're still trying to understand. It's already killed a lot of people, but it's too early to tell what the mortality rate is. We also know that early cases were linked to that market in Wuhan, where we know live animals were in close contact with people, which is not unusual in Chinese markets. It would have given that mutated virus ample opportunity to find a human host.
This virus, this novel coronavirus that we're seeing out of Wuhan, is 96% similar to a virus carried by bats that we have studied in China. So this also is a bat virus. And the big question is, how did it get into this market?
It's very likely that this virus has come from bats.
Bats have lots of viruses. Very few of these viruses actually make them sick.
Bats are not a villain.
Coronaviruses are a type of virus that can spread from animals to humans and cause diseases like SARS and MERS. The latest coronavirus outbreak started in Wuhan, China. So far, it's killed almost 1,400 people and infected more than 60,000 around the world. Scientists are racing to figure out how humans contracted the new virus. Based on initial genetic testing and past outbreaks, they say it's likely the coronavirus originated in bats.
There was a recent paper put out where they looked at the sequence of a virus.
They found that the closest relative to the Wuhan virus was a virus from a bat, 96% similar.
I think that is pretty accepted, that the viruses are very likely coming from bats, but how they're getting to us from bats, either directly or through some intermediate host, needs to be worked out for this new one.
It is speculated that the 2019 novel coronavirus, or COVID-19, originated in bats and was transmitted to humans, possibly with pangolins as an intermediate host. Unfortunately, COVID-19 is now spreading from human to human as well. COVID-19 has surpassed the SARS death toll in a matter of weeks. Even though the death rate is much lower, it spreads faster. Early data suggests that in around 82% of cases, symptoms are relatively mild. The illness begins and ends in the lungs. However, the remainder of cases are severe or critical, typically in older or immunocompromised individuals.
Coronavirus began in China several months ago, and since then, the virus and fear of it have been spreading around the world. There's no vaccine for coronavirus yet, but there is a treatment for fear. It's called facts. And here is a dose of them. Coronavirus causes a respiratory disease called COVID-19. Symptoms include fever, cough, and shortness of breath. Most cases are mild, about 8 out of 10, but more serious cases can lead to severe lung damage. Coronavirus is thought to spread mostly through close contact. An infected person coughs or sneezes, sending droplets containing the virus through the air. Someone nearby, say up to about 6 feet away, breathes those droplets and can become infected. The virus can also spread hand to hand. You touch an object that has the virus on it, then touch your mouth, nose, perhaps even your eye. Scientists are studying how long the coronavirus can survive on various surfaces, or whether there are other ways it can spread. Just 2 days ago, a study from China of nearly 1,100 patients with COVID-19 reported a mortality rate of 1.4%. That means of every 1,000 people infected, 14 will die. The death rate with flu is about 1 in 1,000. But some scientists feel the actual rate with coronavirus may be lower and, in fact, closer to flu, because there are likely many cases we don't know about, either because they're mild or the patients have no symptoms at all. Also, people who are older or who have other ailments such as diabetes or lung disease appear to be at greater risk for getting a severe case of coronavirus. What can you do to protect yourself? Here are a few suggestions. Get the flu vaccine and get your family protected. The flu can mimic coronavirus and make you think you have COVID-19 when you don't. Now, stuff your mother could have told you. Wash your hands, including the tips of your fingers, for 20 seconds. I know that's a long time, but do the best you can. Keep your hands away from your face. Cough into the crook of your arm, not into your hand, or worst of all, right into the air. Stay home if you're sick. You're not doing the boss a favor by coming to work and making everyone else sick. Stay informed. A great source of information is the CDC website, cdc.gov. It's especially helpful for information and advice about travel. What about those surgical face masks so many people are wearing? They may give some partial protection by catching droplets containing virus, but the virus is so tiny it can go right through the mask or around it. If you're sick, a mask might help protect others, but the CDC does not recommend it for routine use. What should we expect in the future? Since this is a new type of coronavirus, it's very difficult to predict. Respiratory viruses often like cold, dry air and may possibly start to die down with warmer, moister weather. But we don't know that for sure, and there could be more waves of infection to come. Bottom line, there's no way of knowing right now how long coronavirus will remain a problem. One thing we should definitely expect is another outbreak of another type of virus. COVID-19 is just the latest example of a deadly viral disease jumping from animals to people. SARS, MERS, and Ebola are others. We need to study why this has been happening. In Asia, deforestation may have increased contact between humans and bats, which can carry the virus that causes SARS or COVID-19. And we must think globally about how to prevent and respond to future outbreaks.
With more than 60 confirmed cases of the coronavirus in the United States, the CDC is expanding their guidance for testing after complaints not enough test kits are available to local medical centers.
So the real death rate is going to be dramatically lower than that. Any death, obviously, is not a good thing, but it will be people who are much older. It's smokers. It turns out that smoking upregulates the receptor for this virus, so they are much more sensitive than non-smokers. It's going to be people with other medical conditions, but this is a real concern. We are going to have quarantines in this country. It's not an if, but it's a when and where it will happen in certain cities. And it will change for a short period our way of life. There's no reason to panic at all, right? All I'm pushing people is have some food, available, get dried food, develop a plan for your kids to be able to learn at home. Talk to your company about working from home. If we're planned for it, it's not going to be a major disruption.